In today's health alert, states across the country are dealing with what some are calling the super flu, and it's driving record hospitalizations. Experts warn the season could get worse before it gets better. Joining us now is our chief health editor, Dr. Partha Nandi. And Doctor, we're seeing nationwide and Michigan really at the top of this list. Feel like we've gone through warm, cold, that could contribute.
Yeah, it's really tough here. This season's really hitting hard. And at my practice, Glenda, nurses, staff have been getting sick, and we've had patients rescheduled even today because of the flu. Nationwide, 22 states were reporting quote unquote very high flu activity for the week ending January 3rd. 14 of those states, including Michigan, are at the most severe level. Some are being hit especially hard. For example, in Colorado, hospitalizations have reached the highest level in over 20 years. And nationwide, weekly flu hospitalizations jumped 53% from the week before. And cumulative hospitalizations, which track the total rate for the season, rose 37%. What about Michigan? Respiratory illnesses now make up more than 10% of outpatient visits, which is above the national average. And we recorded more than 5,900 flu cases for the week ending January 3rd. The CDC estimates at least 15 million illnesses, more than 180,000 hospitalizations, and over 7,400 deaths nationwide so far this season. Too many, in my opinion.
So super flu symptoms, are those worse or different?
Yeah, super flu really isn't a medical term, Glenda, but we usually hear that phrase in tough flu seasons like this one. And this year we have a new mutated H3NU strain called subclade K, and it's really spreading fast. Symptoms look like typical flu, but doctors are seeing longer fevers lasting 3 to 5 days and cough that makes breathing difficult. This can make people feel worse and raise the risk of hospitalizations, with kids and seniors especially vulnerable. As for whether the season will get worse, nationwide flu test positivity rates are starting to ease after several weeks of surges, which is good. The good news also is that it's not too late to get your flu shot, even though subclade K wasn't included in the vaccine. And we've talked about this before. Because it emerged after production began, research shows that protection against the subclade K strain rises from 11 to 39% after vaccination. Plus, the flu shot still covers other circulating strains, given extra protection to you. And as always, please, we talk about this, wash your hands, stay home if you're sick, and seek medical care if symptoms become severe. And again, we repeat it, it's still not too late to get the flu. Please don't give it to others, especially the seniors and vulnerable kids. So it's important to talk about that.
Yeah, got to stay safe and do what you can.
100%, because people die from this.
All right, thanks a lot, Doc.
Of course.
Appreciate it.
My pleasure.
Thank you. Coming up this January 18th, according to the World Health Organization, 35% of women experience intimate partner or sexual violence. In this episode, Dr. Nandi examines sexual violence, including trafficking and rape, and speaks with 2 women who bravely share their stories to inspire change. He also explores path to healing after sexual assault and what society can do to help prevent it. Tune in Saturday, 1 p.m.